Hi my friends, this is my second video in English and I need to give thanks to Norman Lebrecht because since he spread the word about these videos, it's amazing how many of you are sending me wonderful messages, people from everywhere, and it's touching, it helps me a lot and makes me very happy. So thank you for follow me and send messages. They really matter. I will not apologize again for my English. You know now how bad I speak, but I think I can. You can understand me. Anyway, these videos, as I told you in the first video, I will not be able to record every day one video in Portuguese and one video in English. So I'm recording like 2 or 3 times a week a video in English, and I will try to keep you up about the news. I will divide basically the videos in uh, two different phases, two different parts. One part I will talk about the history, how it began, like I did last video, and then the updates. Of course, when in some weeks we will know all my history, and then I can talk just about the updates. But the first thing I would like to tell you, I think it's a good piece of advice. My father died last year with cancer, and we were not really sure which kind of cancer, I mean, where it appeared first. Uh, I will need to consult a dictionary because I can't remember the how I how I translate this part of the body. I don't prepare anything. I'm just spontaneous. It's uh, okay. I think I've bladder. So yes, it appears in his bladder, and the doctor said, "Oh, nobody in your family had cancer before, and your father smoked for his whole life a lot, and sometimes the nicotine, since the nicotine is one of the ways the body uh, put the nicotine out is in the urine. Sometimes you have this case of bladder cancer in people who smoked the whole life. Anyway, this was the version. We were not sure because what happened was his cancer. Uh, what happened was he was urinating not blood exactly, but was like red or pink. And then he went to visit the doctor, and the doctor said, "Okay, you have a tumor." And after he did the surgery, in 1 month he died. So we were not really sure. Anyway, I remember that he was complaining a lot with my mother for several months, maybe almost a year, uh, about a bad pain in his back, and he was complaining with my mother. They were cousins, and it was very funny. They were teasing each other like children all the time, and he was complaining that she bought a bad mattress, and she said, "No, it's an expensive one, the best in the store." He said, "No, it's bad because my back uh, is hurting a lot. I have a lot of pain in my back." And one of the symptoms of the pancreatic cancer is this pain in the back. It was the the first thing I felt in terms of, well, first I was yellow, as I told you. I have this obstruction in a channel who conducts the bili. I don't know how you say that. This thing that the liver, uh, 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 anyway, just medical words are too much for me. Anyway, I was yellow, like I had hepatitis, and it was not. And that was my blessing. The doctor said pancreatic cancer kills a lot because when it appears, nobody knows. In your case, it appears obstructing a channel, important channel, and then you're yellow, and then we could discover it. My father didn't have this luck, and so he has this terrible pain, and he went to the doctor thinking it was something in his spine, a lot of x-rays, and nothing. And then we found out his cancer too late, and we thought it was bladder, but now I'm almost sure it was also pancreatic cancer. I think he had the same thing I have, and it's a little bit scary because now I think we have a genetic component, but in our family never happened before. And for the other hand, uh, creates a connection with my father, who I loved my whole life. We talked every day, 2 times a week. We were together at least, and all Sundays we were lunching together. Very, he was very close to me, and well, I think it was pancreatic cancer. So the first thing I would like to tell you, instead of tell about my history today, is to tell you if you know anyone or even you have this a mysterious pain in your back, like in the lumbar, this low part of the back. If nobody knows what it is, you do the X-rays and nobody discover anything different. Ask your doctor to have this blood test. It's I think it will be the same name in any language. It's CA 199 test. This test can tell if you have a tumor or not. Normal people has this thing, this index until 39. Mine was 5,800. Really, really high, very aggressive cancer. But the good news is that after 5 sessions of chemotherapy, now it's 1,250. So the cancer is really less aggressive now, but still a lot. I have a friend who has the same cancer that I have, and his index is 290. So I'm not in good shape yet, but we are going the right direction. I'm very optimistic. So be aware of that. Nobody told me this before. Nobody knows that. So a mysterious pain in your back is just a blood test. It's not a tomography or anything complex. A blood test. Talk with your doctor. I'm not a doctor. If any one of you is a doctor and think that it's absurd what I'm saying, please send a message. I'm sorry. I apologize. I just have this feeling that if my father, the beginning of his back pain, knew about it, maybe he was alive. I don't regret he had a wonderful life, but of course I would prefer to have him here. And anyway, the last days were really good, really wonderful. I would say that. the last 3 days I was feeling really well. I could work well. I didn't write. I will write music today after this video. A new piece that I'm writing for trumpet and percussion, and it will be called The Youth, A Juventude. It's because of a movie, an Italian movie spoken in English, and it touched me and gave me some ideas. I love to work with uh, metaphors, with ideas that are not musical ideas, and try to translate them in music. I really enjoy to do these things. So there will be it will be the case of this piece. Uh, but I was working hard in my studio because what happened is I'm working slowly, but my doctor said it's good for me to work since I like that much. Have a certain level of a normal life. And as I told you before, I'm passionate about my work. I love to produce, I love to write music. And so I'm trying to, when I can, when I have the strength, when I'm feeling good, when I have the concentration, because sometimes I'm so weak that I can't concentrate. I like to work, and I would I would produce about 10 CDs this year and write like 10 to 14 pieces. I wrote just three, and this trumpet and percussion piece will be the fourth. And I will produce probably 3 to 5 CDs. But three of them have a deadline. And of course, people is aware about my cancer, and I told everybody, I'm not sure I will be able to finish your CD in time. And people are very comprehensive, and since they want to work with me, I feel really flattered, and I'm trying to not disappoint them. Now I learned, instead of I did in my whole life, that it's most important to not disappoint my life, not disappoint my body, not disappoint my soul, my rest, because give no to people were always an issue for me. But it's almost, oh, I'm sorry, it's also important to my soul to work, to have a good work done. It helps me, gives me a reason to live. One of the reasons, the first reason to live for me is my family. It's my daughter. She's 22 and I love her. My mother, she would suffer a lot. She lost her uh, husband last year, and my father, and I'm an only child, so it would be very hard. It would be very hard for her. But also all the things I want to do. And this is, oh, this video is really long. I'm sorry. Uh, I'm about to finish. I was saying a lot that, I mean, before I have the cancer, that I've did enough. I don't really have a reason to be alive. If I die, it's okay. I don't want to die. I love the life. I love my fiance. I love my life. But it's okay if I die. Now I realize it's not. No. I have so much to do, to love, to write, a lot of music to write, a lot of CDs to produce, a lot of people to know, to love, and to help. I really want to help people. When I'm able to, and I have the energy, the strength, I will do a lot of volunteer work. Oh, yes. I want to help people with cancer, but also I want to help people with pain because I had really terrible pain. And, well, now I have a lot of reasons to live. And one of the reasons is my work, of course. And so I was so happy because I could finish 2 CDs this week. I mean, finish, mastering, mixing, everything. And the CD of the symphony orchestra is almost done. I think that in 10 days I will finish it. And so I will be able to finish these 3 CDs in time for the concerts, the release concerts. So I'm glad I could work. I'm glad I had all this energy this week. I was really bad in the past month, I don't know, and it's like a rest. It's refreshing to feel almost normal again. And then we realize that there's not such a thing as normal. Life is movement, life is always different, but we try to control things. It's illusion. It's illusion. I was a young, successful person uh, with a lot of plans, almost about to be completed as my marriage, and my life changed completely. And I'm happy. Yes, I'm happy. I think that happiness is a matter of choice. I choose to be happy every day. Since the same way as I choose to be a composer, and this is an everyday thing. Every day when I wake up, I think I want to be the best Sergio I can. I want to be a composer. Yes, I want to call Bach, Mozart, Beethoven, Ligeti, Stravinsky colleagues. I want to produce CDs because I think there's a new sonority in my mind that's not in the CDs I listen to. So I want to do put this in practice, but also because there are a lot of good music about to be listened, and I help people to give live to their products. Anyway, I talk too much. I will try to do little videos more often. Sometimes I don't have the strength. Sometimes I don't have the time, but I will try. Thank you for all your support. As I told you, I told people in Portuguese in the video in Portuguese, I have like 500 people supporting me, sending me messages, and I feel like this giant wall in my back pushing me forward. So it's impossible for me to stop or to go back. I'm moving forward since I have all this help from you. You give me the energy. Thank you very much. I'm Sérgio Roberto de Oliveira. Be with God or with your beliefs. I believe.